I will start by thanking Livia and Dr. Adib for introducing me to this lovely community, and I want to thank every and each one of you for the great presentations. My presentation is a bit different because it goes from another perspective, the patient advocate's perspective. I'm sharing our experience in this thing from the start and now after 10 years of working with everything. My presentation is colorectal cancer in Lebanon, breaking barriers towards screening and patient support. This is a picture of our NGO members now. After 10 years, we are 47 members working with them. And it was founded in 2016. It's the only NGO in Lebanon and the MENA region specifically dedicated to raising awareness and support for offering support for patients all year round. The story behind SAID NGO, in 2009, my husband his name was Said. So he was 57 years old. We used to do all our annual checkups with a good family doctor who did everything except the colon cancer screening. He never asked us to do colonoscopy or FIT. He was 57 years old and he had no risk and no symptoms. Then suddenly he felt some changes in his bowel movements. We went quickly to the doctor and he was diagnosed with a very late stage of colon cancer. I lost him 2 years later, and I decided after 2 years that what happened with us should never happen with other ones, especially that this cancer is preventable, treatable, and beatable, as all of you know. So it's the name of my husband, and at the same time, it stands for Spread Awareness, Increase Detection, SAID. And since then, let me start first with the CRC context in Lebanon. It's very high. It's higher than the global averages reported by Globocan. And most patients present at advanced and metastatic stage, contributing to high mortality. And the median age is in the late 60s. According to the Lebanese National Cancer Registry in 2023, the incidence of cancer, of colon cancer, in men, it was 21.3 per 100,000, and in women, 18 to 20 per 100,000. And in that year, just 1 year, 1,184 cases were diagnosed. As you know, Lebanon is a dot, like a little point in the map. It's very small. So these numbers are very high. So delayed diagnosis can be understood, the reason behind late diagnosis, because there was no organized national screening program, and the preventive screening, the asymptomatic individuals, it remains sporadic, mostly by NGOs, especially by our efforts. So this leads to late diagnosis, advanced stage disease, and higher mortality. So the barriers, before we started our work on the ground, we said we will explore the barriers to those, why people are not doing the screening. First, we found many barriers at the individual, provider, and the system level. So at the provider and individual level, the awareness is the most important thing. The taboo and the fear of cancer. They will never say the word cancer. If I approach someone and ask him about colon cancer or any cancer, they will hide their face. I don't know if it is common in Europe or in Turkey. And they perceive that the screening is unnecessary because we don't have symptoms. Because we did a study and we were asking them, did you do screening or do you know about screening? And no one knew. From the sample of 1,200 people interviewed, only 37% knew about colon cancer. And out of those 37%, only 49% knew about the screening. And unfortunately, most of those knew not from the family doctor or from the doctors, just hearing from others, my neighbor, my uncle. At the provider level, the FIT screening was not available and it wasn't accessible. They still used, back then in 2016, they used the old, the outdated, the guaiac test, which was like 3 times and not very sensitive. And at the system level, no organized national screening, no insurance until now. So we had to break the barriers. First, through our 3-pillar mission, which comes on awareness, support, and advocacy. Awareness, we started with research studies, and then we followed up later. We do training of trainers, so because we cannot cover the whole country, so we train students and they will do like a snowball effect. And the community awareness. In the community awareness, we use an inflatable colon. This is it's a very, very effective tool for raising awareness. They go inside it, and then we explain before we go inside that we are offering the fit. Would you like to take it? No, what's that? Let me explain to you. We tell them what we see inside the colon during the colonoscopy, and they go from the other side, please write our name. They are convinced. It helped us a lot. So awareness also, the community awareness and the support, we offer the free fit screening, but not only for 1 month, throughout the year, for 365 days a year. And whoever is positive, we make sure they do the colonoscopy. Either they do it, we take an appointment for them to navigate the system and get a good and quick appointment, or we offer them the support, the financial support. We recently, like 4 years ago, we started with the support with stoma care, because as you know, we have a very difficult economic crisis in Lebanon, and the Ministry of Public Health used to support these stoma supplies, but not anymore. So people could not afford it. They were asking us for it. So we have a budget for this. And most importantly, the psychological support. We stand with the patient throughout the whole time. We offer also surgical supplies for surgeries. Like it's a donation from a big major medical surgical appliances. And in parallel, we were advocating locally and internationally. Locally, so these are some of our activities of awareness. As I told you, research, in-person awareness activities, walking groups. This was very, very nicely accepted and liked because of the importance of physical activities in preventing many diseases. Fundraising activities as like hiking, walking. We do virtual awareness through our pages. Please, you would help me a lot if you can follow our pages. Just say SAID NGO. We post always in English and in Arabic to make sure everyone can understand. And the training of trainers to primary healthcare centers and to students from healthcare fields so that they can carry on. So this is the inflatable colon. And the awareness community activities in 10 years that we have done, it's more than 567 activities in 22 districts, and we are tens of thousands of people were reached. So the walking group, we go walk and we always wear blue. Whoever sees me, he sees me in this color, and all the group, because no one knew then when we started what this color stands for. They just said what political party you are. Because in Lebanon, every political party has its own color. So now they know blue is colon cancer. And we take pictures and we do awareness on the beach, like where we do it. So this is the training of trainers. We go to universities, big universities, and help them know about the topic. And at the same time, we offer them screening for their parents and for their community. Like we tell them, and all they have to do is call a WhatsApp call to our coordinator. They call us and she directs them to one laboratory next to their places, and we partnered. And lately we started going to big organizations like engineering societies, pharmacists, like just to tell them you have to spread the word, and at the same time, you are at this age of risk, 45, 40, especially with early onset lately. So, and we collaborated with the family doctors. The family doctor who didn't ask us to do the screening, I asked him when we first was diagnosed, why didn't you do it? He said, I thought he doesn't have a risk factor and he has no symptoms. But I was very angry. So he promised me, he said, I will do my best not to miss any screening. So this guy alone sent us like 3,094 fit results. Of course, anonymous, no names, but just to make sure that we do it. As I told you, we offer the free fit and the colonoscopies, and we make it very cheap. We partnered with 40 labs. We buy the kit, and we partnered for that purpose with 8 hospitals. Very good hospitals, but they gave us a very cheap price, and we sent these people to do this. So the fit uptake has increased. This figure up, it was in 2017. We gave 619 people, like they registered on our platform, and still with awareness, with everything, and only 215 went and did the fit test. While in 2025, we offered 1,449 fits who registered on our platform, and look, 74.48% went and did the test. And we followed up also with the colonoscopy. So our follow-up is from A to Z. It's awareness, behavior change, convenience, digital and reminders, engagement, follow-up, and guided care. Cost of supplies, we offer the free stoma supplies, and this is the advocacy locally. In 2016, our NGO started. In 2017, in August, like 1 year later, we succeeded in putting a national plan. We did the first national campaign, but the minister then did not accept to do awareness and screening. He said just awareness. I said it's not important, but at least it's better than nothing. And then COVID came and the crisis in Lebanon. We stopped like 2 years. Back in March 23, we did a bigger campaign of awareness and screening. In August 23, the Ministry of Public Health put a national cancer plan, and we are in the advisory committee of this plan. And in February 26, we succeeded in creating the first national committee to launch the organized screening campaign. Our plan was to launch it in March 21 this year, but unfortunately, you all know what's happening in Lebanon. The war erased everything, and we couldn't do it. So these milestones, I think they reflect our commitment to saving lives through awareness, early detection, and the importance of strong partnerships. So this is the national plan. At the international level, we are members of these 4 big patient advocates. Digestive Cancers of Europe, Global Colon Cancer Association in the US, Inspire to Live in Holland, and World Patient Alliance. We are also at the advisory committee. And we are happy now to be a member also of this lovely community. So this is the global advocacy. Our main event happens also always in March. We do a big something called Walkathon, March for Colon Cancer. So we walk, and we succeeded in engaging people, politicians, ministers, hospitals. And last year, more than 1,221 people walked with us for the 5K, and it was a great event. So this is the measurable impact at a glance, like everything we've done. So the impact of awareness and action, it moved from sporadic messaging, and now it's a continuous national presence. We are always on the media. We are always on our social media. You can see that we post Monday, Wednesday, and Friday. and in both languages, and we are always doing conversations with people, and the awareness consistently translated into engagement and action. So what people need to be aware, to be screened early, to be guided through system, to access care whether insured or not, and prevention must be accessible at all. And this is what we have been doing. Looking ahead, supporting the implementation of organized national screening program, expanding patient navigation and survivorship programs, expanding regional and international presence, scan the QR code, and you are inside the website and on all our social media. Together, we promote awareness, support patients, and save lives. Thank you.
Raise your hand and come join SAID. Spread awareness so that they'll be screened. Know that CRC is not a grief. Hail SAID, hail SAID. There's a mission that we will share. We will show the world that we care. Hear the members say, come without delay. Hail SAID, hail SAID, hail SAID.